Welcome back to our YouTube channel Disease Diaries. Did you know that every 2 minutes, a child dies from malaria? Or that over 200 million people are affected by this deadly disease every year? Malaria is a global health issue that demands our attention. In this video, we'll dive deep into understanding malaria, its symptoms, causes, diagnosis, prevention, and treatment. So grab your notepad and get ready to learn how to combat this deadly enemy. Introduction. Malaria is a life-threatening disease caused by the bite of infected female mosquitoes carrying the parasite. It predominantly affects tropical and subtropical regions, placing millions of lives at risk. The urgency to understand this disease cannot be overstated, as increasing awareness allows us to take action and save lives. Transition. Now that we appreciate the significance of this topic, let's explore the nitty-gritty details of malaria. It's time to uncover the symptoms, causes, diagnosis, prevention, and treatment methods that are vital to combating this challenging disease. So, let's get started. The initial symptoms of malaria may often be confused with the flu. Fever, chills, headache, muscle aches, and fatigue are common warning signs. However, as the disease progresses, more severe symptoms can appear, such as anemia, respiratory distress, jaundice, and even organ failure. It's critical to identify these symptoms early to seek timely medical intervention and decrease the risk of complications. Malaria is caused by parasites of the Plasmodium family, with 5 species being the main culprits: Plasmodium falciparum, Plasmodium vivax, Plasmodium malariae, Plasmodium ovale, and Plasmodium knowlesi. These parasites are transmitted to humans through the bite of infected female Anopheles mosquitoes. Understanding the life cycle of these parasites is crucial for effective prevention. Accurate and prompt diagnosis is essential to prevent severe malaria. Diagnostic methods include blood tests, such as microscopy and rapid diagnostic tests, RDTs. Microscopy involves examining blood samples under a microscope to identify the presence of the malaria parasite, while RDTs provide faster results by detecting specific parasite antigens. It's crucial to diagnose malaria correctly, as misdiagnosis can lead to inadequate treatment and potentially life-threatening consequences. Prevention is better than cure when it comes to malaria. Various preventive measures can be taken to reduce the risk of getting infected. Insecticide-treated bed nets, indoor residual spraying of insecticides, and wearing protective clothing are effective ways to minimize exposure to mosquito bites. Additionally, taking anti-malarial medication as prescribed by healthcare professionals is crucial for individuals residing or traveling to malaria-prone areas. Early diagnosis and appropriate treatment can save lives. Antimalarial drugs such as artemisinin-based combination therapies, ACTs, are the primary treatment for malaria. The choice of medication depends on the type of malaria parasite and the severity of the infection. It's essential to complete the full course of treatment to ensure complete eradication of the parasite. Now that you're armed with the knowledge of malaria, it's time for action. Start by sharing this video with your friends and family to spread awareness. Comment below if you have any personal experiences or tips to share about malaria. Together, we can make a difference and protect vulnerable communities from this deadly disease.